one of the things that we really have to talk about is our mental health and how we see ourselves and the inevitability of chronic diseases like high blood pressure, diabetes, and all of those things, right? So as Black people, it's important for us to understand that this isn't some self-fulfilling prophecy simply because my mommy, my grandmommy, and my great-grandmommy all had some form of cardiovascular disease does not guarantee me that I will have to walk the same path. And it's one of the reasons why I have been very purposeful in the decisions that I have made, even when I had barely two nickels to rub together in terms of the dietary choices and the exercise choices that I made personally and the example that I set for my daughter. And I bring my cousin up because there were choices that she made that facilitated her early death. And one of the things that breaks my heart and makes me committed to doing what I do is how much life we lose as Black people because of chronic diseases and not having a safe space to have these kinds of conversations where we talk. Like, I will be real with my patients on a regular basis. When they come in here and their blood pressure is still 160 over 90, I'm like, sister, brother, what's going on? What do we need to do? And so one of the things that I have my patients do is they write a letter to themselves or record a video to themselves. And the questions that I ask them, and this is your part of your homework assignment, is if I do not control my blood pressure in the next 5 to 10 years, what does my life look like? And what does the life of my family members look like, right? Because it's not just that you might die early, but you may have a stroke. And then there are loved ones who will have to take care of you. You may transition early. And then what does that look like for your family? But I don't leave it there, because then it's in 5 years after having participated in this program and I am just knocking it out of the park and my blood pressure is much, much better. What does that look like for me? What does it feel like? What does it smell like? What does it taste like? What is that experience? And I want you to be very explicit. Like, it is me not having to worry when I get a headache, that isn't just a basic headache. It is me not having to worry that if my chest starts to hurt, that I don't have to worry that this is my high blood pressure acting up, right? What does that look like, feel like, taste like, smell like for you? And you commit it to paper, you commit it to a video, so that when you get ready to slip and dip and get that 12 pack of ribs, mac and cheese, and barbecue beans, because that's what we're doing this weekend, it pulls you back in, right? It pulls you back in to remind you, because as a physician, I'm here to partner with you, and every healthcare professional that you have should be seen as a partner and they should act as a partner. But when it comes right down to it, in those moments when you are by yourself, and you know each of us has them, when you are by yourself having to make that decision on your own, it's that internal compass, whether it be the Holy Spirit for those of us who are spiritual, your higher power, your ancestors, your good guy, bad guy on your shoulders, whatever it is. That's what we do to pull us back in.